So just a couple kind of quick facts right off the top. So UTIs are actually the most common outpatient infection that most people experience in their lifetime and come into clinics for. Most people will likely experience at least one UTI throughout their lifetime at any point, and we all know how those can really, really ruin our days. So first, let's talk about what a UTI is. So a UTI develops when there's any kind of microbe, be it bacteria, that enters through the urinary tract. And when we're talking about the urinary tract, we're talking about the bladder, but we're also talking about kidneys and then the urethra, which you're actually peeing out of itself, that can get infected. So typically it's going to be bacterial infections that are causing UTIs, tend to be the most common source, and most commonly it's going to be a bacteria called E. coli. Women are more likely to get UTIs over men, and that's just because of the women tend to have a smaller urinary tract versus males. So we're more likely to have bacteria enter the urethra and the bladder in females over males. What are some common symptoms of UTIs? So some common symptoms are you might feel a bit feverish. There might be a persistent urge to urinate. You might feel like more so than normal. You're like constantly feeling you have to go to the bathroom. Other ones are your urine might have a little bit of a smell to it. It can be cloudy in appearance as well. There might be a burning sensation when you're peeing, and the other one can be a lot of pain kind of through this region itself, kind of the base of the pelvis, center of the pubic bone area. Those are just some of the most common ones, but there are a lot of different symptoms that you can be having. If you are experiencing any of those symptoms, though, it's good to go ahead and contact your health provider and get a screening, because you don't want to develop worse symptoms and have that infection spread elsewhere. So definitely want to get that screened and checked. But let's talk about what are some good prevention things that you can do for UTIs. So the first one is drink plenty of water. So the recommendation is between 6 to 8 glasses of water daily, and that just flushes the bacteria out of the urinary tract, making sure you're peeing pretty frequently. It also dilutes the urine. The second tip I have for you is do not hold your urine for a long period of time. So I know here at Pelvic PT, we're constantly telling our patients, hey, don't go to the bathroom if you feel like you don't need to go. But that is something if you're more going every hour. This is talking about people that tend to hold their bladder all day. I'm talking about nurses or teachers that tend to go 4 to 6 hours without peeing. That can be a big source of development of UTIs, because that urine is just sitting there for a long time. So go to the bathroom I would say at least every 3 to 4 hours would be a good habit to get into. The other thing is make sure you're fully emptying your bladder when you're peeing. So the best way to make sure you're doing that is once you feel like you're sitting on the toilet, you're done peeing, go ahead and lean fully forward, lean back, side to side, and that'll just make sure you're emptying everything out in one sitting. The other thing you can try is pelvic PT. So a lot of the research shows that people that tend to get more frequent UTIs tend to also have really tight pelvic floor muscles, and there's a lack of coordination also with those muscles. And so if you're sitting on the toilet and you're not feeling like you're emptying everything fully, it could be because you're really not. Your muscles are just clenching on and not relaxing all the way to fully empty your bladder. So come on in for an evaluation to check that out to see if that's one of the reasons you are getting a lot of UTIs. The fifth one, which I found really interesting, is talking about there's so many different bladder supplements out there to claim that they prevent UTIs or treat UTIs. The research that I came across actually showed that if you currently have a UTI going on, cranberry supplements are not going to do anything. But you can use cranberry on a regular basis to prevent UTIs. There is a certain chemical that cranberries have which can coat the lining of the bladder, and it prevents a bacteria from sticking to the bladder. So I found that really interesting too. If you tend to have UTIs pretty frequently, you can get on any of the common bladder support supplements almost, and that can help if they contain cranberries to coat that bladder to prevent bacteria from sticking. Another one is wiping from front to back. So the rectum tends to be a big source of that bacteria I talked about earlier, that E. coli that's most frequently causing UTIs. So always wiping from front to back to prevent that spread. And then that last one is making sure after any kind of sexual activity, making sure you are peeing after, since there's been a new bacteria that potentially was introduced. So try any of those tips out and let's prevent those UTIs. Have a good rest of your Wednesday. Bye.